At the core of our sexuality is our sexual and reproductive health and rights. This is simply about the health of those parts of the body that have to do with sex and reproduction. Reproduction is a scientific word for making children. When we talk about sexual and reproductive health, it is important that you know and really understand what rights you have in regards to your sexual and reproductive health. Our sexual and reproductive rights are part of our human rights. And as a leader, you can play a meaningful role for your players to always talk about sexual and reproductive health from a rights-based perspective. Meaning that you, along with talking about sexual and reproductive health, you also talk about the rights we have and that we're all entitled to when it comes to our sexual and reproductive health. Having a good sexual and reproductive health means that all parts of the body that deal with sex and reproduction are in good health. But what is required then? What do we need to have good sexual and reproductive health? First and foremost, it is about having access to information. We need basic information to know how to take care of our bodies. It can be, for example, information about hygiene during menstruation. If a person does not take care of their hygiene when they have their menstruation, there is a risk of infections. It can also be, for example, information about changes your body goes through during puberty, in order to understand that these changes are completely normal and something that you don't need to worry about. Secondly, access to contraceptives is needed. Contraceptives protect against unwanted pregnancies and sexually transmitted diseases, what we call STDs. We need to know that there are contraceptives, how they work, and how and where one can get them. Of course, it is also required that one has the conditions to obtain contraceptives, that you can afford them, that they are close by and easily accessible, and that the contraceptives you use should work and feel good for you. This is especially important to remember if we train young girls who are on their way into puberty, as different contraceptives can have different negative side effects for different people. If a contraceptive does not work for you, you have the right to switch to something that does work for you. It is though common that young girls hear, that's the way it is, you might feel ill, but that's just normal. And it is important that young girls understand that it doesn't have to be the case. They do not have to accept feeling ill or having any other negative side effect. It is always possible to change to something else. And if the midwife says that you can't change, well, change the midwife. Condoms are the only contraceptives that both protect against unwanted pregnancies and STDs. There are often youth or health clinics in your community where young people can go for free, where you can get free condoms and information. In order to have good sexual and reproductive health, access to healthcare is also required. So, for example, access to gynecologists or midwives, as well as health clinics. And it can be difficult for a football coach to influence all this. But what we can do, and that is really important, is to provide information and a forum where questions related to sexual and reproductive health can be asked in a non-judgmental way, and where girls can feel safe to discuss these questions, thoughts, and worries together with their peers, and where you as a coach can provide them with support. This does not mean that you need to have the answers to all questions, but what you can do is direct your players to where they can get facts and information from health professionals, online or in their community. This allows your players to receive correct information and get access to a nearby health clinic should they need any further help. And if we have the possibility, we can also help to make contraceptives available. For example, by having a few condoms in the medical kit, just as we have bandages and menstruation pads.